Well, COVID cases continue to decline across the state, and that means relief for doctors, nurses, and hospital staff. We got an inside look at how COVID hospital wings are operating now. On floor B7 at IU Melt's Methodist Hospital, it's busy, but nothing compared to 2 years ago. As soon as the virus hit, the hospital began dedicating certain COVID floors. And at one point, all 24 beds on the floor were occupied by COVID patients, with yellow carts lining the hallways full of PPE. But as of yesterday, there weren't any COVID patients on that floor. And as the pandemic continues, the hope is that it will only get easier from here.
Could it be something that we're going to have to live with? Yes, that's very possible. And so I also hope in that regard that if it's something we're going to live with, that we're much more equipped to deal with.
Well, for now, Dr. Gavin and his team are just taking it one day at a time, they say.
Well, Moderna announced this week its COVID vaccine works just as well in young children as it does in adults.
Yeah, but despite the promising data emerging as the FDA considers emergency use, a large number of parents still aren't getting their kids the shot. Here in Indiana, only 20% of children 5 and up have the COVID vaccine, according to the State Department of Health. Nationally, those numbers are a little higher, with 1 in 3 kids fully vaccinated. Dr. John Christensen with Riley Children's Health says that that's concerning.
I think it has got a little easier to talk to people about flu, for example, but because there's a lot of flu activity in the community. But once you bring up coronavirus, they have no interest because everybody tells them that coronavirus is more or less gone.
Well, Dr. Christensen says he wants parents to know that the vaccines are safe and effective for adults and for kids. And if you have questions, he says don't turn to social media. Call your doctor instead.